Hello, my name is Dave Wiesel. I'm an Associate Professor of Anesthesia at Boston Children's Hospital and Harvard Medical School. Today I would like to discuss my article in the Mayo Clinic Proceedings, Revocation of Board Certification for Legally Permitted Activities. The vast majority of physicians in the United States are board certified. Medical specialty boards award board certification to physicians who have achieved a certain level of excellence. The purpose of the medical specialty boards is to ensure the public that if they go to a board certified physician, that physician can provide a certain level of treatment. To do so, the medical specialty boards have a number of standards. One of the standards is professionalism. To maintain the level of professionalism, medical specialty boards also put in standards by which they may revoke board certification. Typically, those are related to things like committing a felony or having a medical license limited or revoked. And in some cases, they refer to misdemeanors of moral turpitude or of professionally related activities. Lately, there's been the addition of cheating on board exams, since that has become an intermittent problem. But recently, the American Board of Anesthesiology broke a new barrier by stating that board certification may be revoked for a legally permitted activity, in this case, physician participation in lethal injection. Now, to be sure, this paper is not about the American Board of Anesthesiology and their prohibition on physician participation in lethal injection. But it provides a useful mark for us to embark on this discussion about under what circumstances is it appropriate for a medical specialty board to prohibit a legal activity. I think it is important to have that discussion at this point while we're still at the beginning of doing this, so it doesn't run rampant in ways that we may consider it undesirable. For the most part, historically, it does make sense for medical specialty boards to be able to prohibit certain legal activities in the name of professionalism. I would promote 5 criteria by which we can determine whether a legal action can be used to revoke board certification. The first is clarification of whether it is unprofessional. Now, this just cannot be a personal opinion. This needs to be a substantive argument that has undergone a discussion in the literature. An argument that has not undergone the crucible of academic discussion is not fully tested. The second would be it has to be relevant to the profession. So using the example of the American Board of Anesthesiology's prohibition on lethal injection participation, one can say that that is relevant to the profession of anesthesiology because of the superficial similarity of lethal injection and inducing general anesthesia. It would not be relevant to professions that are not involved in any way in this area, such as, say, pathology. The third would be there has to be a relevant harm. The fourth is, by what mechanism will the harm be caused? In this case, how will patients find out that anesthesiologists participate in lethal injection? And how will that knowledge affect their ability to trust anesthesiologists? And the fifth is, by what evidence will this cause harm? In other words, we can say that a patient may know about it, and we can suppose that a patient may become anxious about receiving anesthesia and surgery because of it. But how do we know that? What evidence is that based on? And this is very important because if we are going to limit the activities of physicians, we should have strong evidence that it will cause harm. One area this fails is in the slippery slope argument. So for example, when discussing legalization of euthanasia, people may argue, oh, but if you do that, we're going to lead to Nazi-level atrocities. That is a big leap that needs to be broken down into very clear, concise, and small steps to indicate you can actually get there. So what was once called the great big slippery slope argument, a hand-waving argument of it's self-evident, cannot legitimately apply. The last concern is process. This should and must be an inclusive process, which include all stakeholders, the boards, physicians, and the public. We can see an example where a lack of inclusive process fails with the recent issue with the American Board of Obstetrics and Gynecology. They recently prohibited gynecologists from treating men except in the rarest of circumstances. The problem was that gynecologists were actively treating men for rectal cancer because of their expertise in cervical cancer. The prohibition then brought an uproar from patients, physicians, and those conducting research in this area because many gynecologists were involved in appropriate research. Eventually, the uproar got so loud that the board rescinded their mandate. And they said in part one of the reasons they rescinded their mandate was because there was too much noise about this and it was too distracting to the board's mission. Perhaps this uproar could have been avoided if the American Board of Obstetrics and Gynecology had used a more inclusive process from the beginning. My hope for this article is that this will spur a discussion on when a medical specialty board may prohibit a legally permissible activity. Thank you.
We hope you found this presentation from the content of Mayo Clinic Proceedings valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you will find access information for our social media content, such as additional videos on our YouTube channel or journal updates on Facebook. You can also follow us on Twitter. More information about healthcare at Mayo Clinic is available at www.mayoclinic.com. This video content is copyrighted by Mayo Foundation for Medical Education and Research.